So if you give us the go-ahead, we can proceed.
In resolving issues, is one of the highest in the region, goes to the tertiary level.
Very briefly.
That failed, then you have no audacity. So what we are saying is that we are not just politicians in supporting doctor strike.
Tomorrow, members of the Kenya Medical Practitioners and Dentists Union are beginning a countrywide doctors' strike after talks with the Ministry of Health bore no fruits. As we know, the Health Cabinet Secretary has been very casual and dismissive in her approach to this matter. It could be a problem of capacity. We don't know. Consequently, from midnight, hundreds of thousands of visits to outpatient clinics will have to be cancelled or postponed. Tens of thousands of scheduled operations or surgeries will also have to be cancelled. Public hospitals, which provide most of the secondary and tertiary medical care, will have their emergency rooms, dialysis units, oncology departments, obstetric and neonatal departments, and other vital facilities shut. The country is therefore staring at deaths and complications that could have been avoided. Those deaths and medical complications will have to be blamed on the out-of-touch Health Cabinet Secretary and an uncaring Kenya Kwanza administration.
Tunataka kufikiria waziri akiwa mama anafikiria kutafanyika nini usiku wa leo baada ya saa 6, wamama wajawazito washikwe na uchungu wakimbia hospitali, hakuna madaktari. Wamama hawa tutawapoteza. Mama yule mtoto mdogo atashikwa na homa usiku aende hospitali kutafuta usaidizi, tutawapoteza. Idara hii imeweza kukosa mwelekeo, imedisappoint Wakenya wote, na hatuko tayari kama wabunge kuungana na serikali hii. Haiangalii mahitaji. Daktari ndio mtu wa kwanza amesoma masomo zaidi, miaka 6 kati ya karia zote, na yeye ndo analipa mshahara wa chini. Utapata daktari anapanda bodaboda anaenda kuhudumia watu hospitali. Kuna ile kesi ya Nakuru. Ni nini serikali haiwezi kuona? Walimu wanalia. Kila mtu hapa yuko kazini kwa sababu ya mwalimu. Walimu hawaangaliwi Kenya. Polisi hawaangaliwi Kenya. Ndio wale wengine wanapelekwa Haiti, sijui kutakuwaje. Lakini madaktari tunawaunga mkono kwa sababu hii Kenya lazima usukume uende mgomo ndio serikali isikie. Lakini tunataka kusema, tuambie rais wetu afikirie watu watapata accident usiku wa leo, watahudumiwa na nani? Majeraha watahudumiwa na nani? Ni vifo tunatafuta vya watu wetu Kenya au ni nini? Huduma ndogo tu, kuwalipa mishahara wahudumu wa afya, madaktari wetu, hii Kenya iwe salama.
We wish to make it clear that we stand with the doctors in this strike and their demands. It is our understanding that the doctors are not fighting for themselves. They are fighting for Kenyans, and especially those with no capacity to seek health services in private hospitals, and therefore must make do with public hospitals. In asking for health budget to be raised to 15%, the doctors are fighting for better health services for Kenyans. In demanding that the government operationalizes the Facility Improvement Fund, the doctors are fighting for the people of Kenya against a government that does not understand and does not care. We have seen the casual, reckless, incompetent, and overly simplistic manner in which the Health Cabinet Secretary has handled this matter so far. It is incompetence of the worst type for the Cabinet Secretary to keep lamenting that the National Treasury has not given her money. It is not for the doctors or Kenyans to look for money from the National Treasury. That is the work of the Cabinet Secretary. We are dealing with the government. Both the National Treasury and the Ministry of Health are under the Kenya Kwanza administration. If the Health Cabinet Secretary is not able to make the National Treasury release funds for a critical ministry like hers, then she has no option but to quit, really. Maybe she's a joker. We don't know again. Maybe she does not understand the ministry and has not been able to make a compelling case for release of funds, or she just doesn't care. Whatever the case, Susan Nahumicha has failed the medical fraternity and the whole country. She must be prepared to take responsibility for any deaths that may result from this strike.
The training of doctors, the training of nurses, the training of clinical officers, the training of pharmacists is something that is planned and is known, and every year the number that is coming out is known. So we cannot fail to plan for that if we go by the simple policy we have stated that after graduation, the doctors do internship. 2, we must understand that internship is critical. It is not the employment of doctors or the nurses who do it, or the pharmacists. It is a requirement, particularly for doctors, that they do it and then they get registered. So if you fail to get doctors who have graduated to do internship, you will not have doctors, because without internship, they cannot practice on their own, they cannot be employed, and if you intend to export them, despite our shortage, as I often hear, they cannot work out there. So that is something that is not new. 2, the feeling that internship for doctors is a training and therefore that they should not be paid. I've heard that implied is a fallacy. The interns man the hospitals they work in. They're the first on call. They are the first to see patients. They will call their seniors after they've seen them. In many cases, they don't. Interns who have done mid-course, who have done at least 6 months, you will find them doing cesarean sections. And in fact, I would say that if we actually don't have them, I don't know how hospitals will operate. So they are working. Even if we call it training, they are working. They are a workforce.
What is it that the Ministry of Health did not see coming? It is the policy of the government that interns should be posted 30 days after graduation. It has delayed by now 8 months, and there's no end in sight. Didn't the government know the number of doctors who are going to graduate each year, and the policy that they have to be posted as interns 30 days after graduation? We are witnessing a clear demonstration of serious mismatch of policies, roles, and responsibilities that run across the entire Kenya Kwanza administration. It is the same confusion in the Ministry of Education, Agriculture, and everywhere else. A wrong person in a wrong job always poses a disaster. A government that talks of universal health care but cannot find money to place intern doctors is a contradiction that is worrisome. Throughout the standoff leading to the imminent strike now, the Ministry of Health has acted like an uncaring bystander. The attitude of the ministry has oscillated between cowardice, contempt, and incompetence. The ministry completely failed to learn the lessons of the past doctor strikes and refused to constructively engage with the KMPDU until the last minute. Instead of treating the medical workers with the respect they clearly deserve, the cabinet secretary took to lecturing them at political rallies where the doctors are not normally present, unleashed police on them and resorted to mudslinging matches on social media. This is completely unacceptable. We are witnessing the consequences of a entrepreneur-driven government system in which prioritization of what to finance and what to downgrade depends on expected kickbacks. If posting interns had room for decent kickbacks to Kenya Kwanza mandarins at the National Treasury and the Ministry of Health, they would be fighting to have them posted. That is why there is money for affordable housing, alleged subsidized fertilizers, and edible oils, but none for intern doctors. That is how pathetic it has become.
Tunajiulizwa tukiwa na hofu nyingi sana. Namfikiria ule mama ambaye atakimbia hospitalini leo, usiku wa leo. Atafika pale, amebeba mtoto. Ana uhakika anajipeleka kaburini. Manake ana hakika haendi kupata tiba lolote. Lakini atafika pale. Cha kwanza changamoto, hamuna madawa. Hamuna vifaa vinavyofaa. Alafu tena zaidi ya haya, hakuna daktari atakayemhudumia. Kuna vitu vya kuchezea, lakini afya ya binadamu sio kitu cha kuchezea. Na ninasema kwa uchungu kama mama, kama kuna mama wote atakaye kufa Migori County akijifungua, na kukuhakikishia Ruto, hiyo maiti nitakufikishia Statehouse uizike wewe ama uile wewe. Manake ni chungu sana. Fikiria binadamu, maisha ya binadamu sio kitu cha kuchezea. Mbele ya Mungu wako siku ya hukumu utazungumza nini? Huchungi wanyama, huchungi hata binadamu. Kweli fikiria kama una wakati wa kufikiria. Mgomo huu uisimamishe, fanya kitu cha haki ya kutetea madaktari, kwa sababu hata wewe unatibiwa na madaktari. Lakini una pesa unakimbia hospitali makubwa. Wasiojiweza wanakuangalia, masikini wanakuangalia, na sisi wabunge tutaungana nao, tutaandamana, lakini jitayarishe maiti zote za Migori County na kuletea Statehouse. Uzile wewe. Ile pesa unakunywa nazo chai, unaentertain nayo marafiki zako kule. Imetosha kuwatetea hao madaktari. Maiti hizo zitayarishe kuzipokea.
Number 2, we have the issue of UHC staff that were employed on contract, are earning less, and now are to go. I don't understand what policy will do that, because UHC is universal health cover, and we did a pilot, and we are saying we are going to now expand it. If you are expanding a program, how then do you get rid of the people who started the program? That is a policy discrepancy. Why, if it is a program, why should they earn less than their counterparts if they are doing the same work? The word UHC, that was UHC, people were employed on UHC, was just a description to raise the money. If we raised the money at that time from the budget, we had enough time to plan, so that as we now implement UHC full time, we take them on, add more, and pay them as everybody else is being paid. So to me, this is a failure to implement policies, or poor policies that are also not being implemented properly. So I really think we have no option as a country to plan and implement internship properly from the time people get into medical school or training colleges to the time that they do internships, are released to go and do the work and help Kenyans.
The fact that medical doctors are not only workers, but they also provide essential services that must be prioritized in this country. Yesterday, we did see that the cabinet had actually had a meeting at the residence of the deputy president. And one of the expectations of that meeting was that they would discuss this matter and treat it urgently, and also actually address the nation in regards to the solutions that they have put in place. That did not happen. Right now, we have 11 hours to the strike. And my expectation is that this is a matter that should actually sit at the president's desk, because the buck stops with him. If our doctors are not able to work, if our hospitals are not going to be manned, if the emergency situations that are going to happen from midnight today are not going to be handled, it means that the lives of Kenyans are at risk. This is a crisis, and my thinking is that the president should actually take responsibility and deal with this matter if his cabinet secretary is not able to do so, and deal with it appropriately and with the urgency that it requires. If that does not happen, then the president needs to tell us that he does not know how to do his work, that he is not ready to do his work. Medical doctors have to be given the priority, they have to be given their compensation as it should stand, and National Treasury should also tell us, is it that you don't have money? Is it that you have not collected enough? With all the taxes that you're charging Kenyans currently, why are you not able to pay our workers? And so within 11 hours, as the AZIMIO coalition, we want to hear what solutions you have put in place to ensure that you actually avert this strike.
Beyond health, however, we are dealing with fundamental moral questions in this strike. What message are we sending to our youth as a country when young people study hard in high school, score top grades, study medicine in university, then the government tells them that there's no money for internships, leave alone employment? What kind of a country is Kenya Kwanza running? There's no doubt whatsoever that those doctors being brutalized or being addressed dismissively by the cabinet secretary are more intelligent than some government officers who are frustrating them. No wonder Kenya is suffering from unprecedented brain drain. Kenyans are aware that health professionals are not properly paid. We are aware as a country that majority of our health professionals are leaving the public healthcare system for the private sector. We are aware that health workers are overworked and underpaid, and this has consequences for the health of our people. We demand that the ministry shares with Kenyans its plans for the people to access emergency treatment, critical care, maternity care, neonatal care, and trauma in the event that this strike takes off, as is very highly likely.
Today in the morning, I met with the leadership of Doctors Union, and what came out of our meeting today was very clear. There is a serious lack of leadership in the Ministry of Health.
Yeah.
And I would want to call upon the Minister for Health and the Principal Secretary to resign, because they don't have what it takes to run this ministry. The minister made a very silly mistake when the leadership of Doctors Union wanted to engage her on dialogue. Instead of meeting the leadership, she opted to call interns themselves to bypass the leadership, which means she lacks what it takes to engage, to lead such a serious ministry. And as a trade unionist, we believe in dialogue, we believe in consultations, we believe in literally engagement. But now, if you have a minister who is not aware or who is not able to engage, then there is a very big loophole in that ministry. When you go there, you'll find the PS is talking his own things, the minister is talking his own things. They are not communicating. There is a very big communication lapse between the office of the PS and the office of the minister. So nobody is delivering in that ministry. Instead, there is serious fights. There are serious groupings in the ministry which can bring health sector down. So come midnight, as trade union leaders in this country, we are fully in support of Doctors Union to down their tools come midnight, and we want to ask Kenyans, if you want to fix the issues of health, let us support this strike once and for all. And at the end of this strike, the solution will be gotten. That solution will bring down the poor leadership in that ministry. We get the right people to run health, and the whole country will be healthy. But if we fail to support this strike, we will continue with ailing health system in this country forever.
That strike is now imminent. And for the avoidance of doubt, we stand in solidarity with the doctors.
Sure.
And we demand that the government does whatever it is necessary, first and foremost to avert the strike, but more importantly, to address the issues that the doctors are raising. Critically again, the consequences of this strike will have to be borne by the cabinet secretary in the ministry and her permanent secretary. In other words, the Kenya Kwanza administration will have to take responsibility for any deaths and other eventualities that will emanate from this unfortunate strike. We believe that this government has got wrong priorities. It has got its priorities upside down. And if nothing is done urgently, the health care system is going to collapse totally. And that is something we cannot allow as members of the AZIMIO Umoja One Kenya coalition. We shall stand firm and demand that the government does the right thing.
From the word go, we have seen the budget of Statehouse is bigger than money is going to the counties. We have seen the office of the deputy president, his resident, being renovated at a cost higher than the cost that was used to to put it up. So it is just wrong, immoral, actually amoral for what this government is doing. Can it avail money for doctors? Any government that respects itself must take care of its citizenry.